and thank you for joining us today. My name is Caterina Lombardo, and I am part of the SBRI Healthcare PMO, the Program Management Office. And today, together with our speakers, we will discuss a new exciting funding opportunity. In fact, SBRI Healthcare has a new funding opportunity launched by the Accelerated Access Collaborative, which will focus on innovations that will address the NHS Net Zero agenda. And just I want to say that this competition builds on another competition that we launched last year. That was the first of a kind. We in fact partner up with the Green NHS program and the Academic Science Network on this topic, and we managed to fund 10 promising innovations that have just currently finished their pilots. So if we can go on to the next slide, please. We have a quite packed agenda today, and I wanted to emphasize our webinar today will be divided in two parts. So there is a first part in which our speakers will cover a bit more the rationale of this call, how it fits in the strategic priorities of AAC, and then we will go into the details of what the challenges of focus of this call would be about. And then there will be a Q&A session for you to ask questions to our speakers. And then we move on to a second part of the webinar in which we will have a couple of the innovators I just mentioned that will share their experience. Then a presenter from the Academic Science Network that will discuss how they can support you in your journey, and someone from the SBRI Healthcare PMO that will talk into the nitty-gritty of application process and what you need to do to apply. So, and then there will be another Q&A session then at the end for you to ask all the questions you have left. So if we can move on to the next slide, please. Before we crack on, just a couple of housekeeping points. You're all familiar with webinars by now. It's been a couple of years that we've been using Zoom, but I wanted to point out to ask you the courtesy to ask your questions using the Q&A box and not the chat, because the speakers and myself are monitoring the Q&A box and not the chat. Only do use the chat if you have any technical issues that we can address. And yes, this webinar is recorded, and the recording will be made available on our website, but please do stay on because today you have an opportunity to ask questions live to our speakers, which you won't have if you watch the webinar. So I think without further ado, I'll move us on to the next speaker. So we do have Lindsay Hughes, who is the Director of Research and Engagement at AAC and NHS England, NHS Improvement, and we'll talk, actually NHS England from now on, who will talk about how this competition fits within AAC strategic plans. Over to you, Lindsay. Thank you.
Thank you, Caterina, and good morning, everybody. I'm delighted to join you for this webinar. I'm just going to give a very short introduction to the AAC for those of you who aren't aware of who we are and what we do, and then I will hand over to colleagues who will give you the most interesting part of the presentations today on the actual competition itself. So, the AAC is a unique partnership between patient groups, government bodies, industry and NHS bodies, and you'll see here on the slide the number of organisations who are our partners within the AAC and some of the people who sit on our board. So the board is chaired by Lord Darcy and our CEO is Matt Whitty. We are hosted within NHS England, and we are very privileged to have the CEO of NHS England on the board, along with some esteemed colleagues such as Professor Chris Whitty and Dr. Sam Roberts, who's the CEO of NICE. Next slide, please. So what the AAC does is brings together all the collective wisdom and experience and skills of those organisations that you've just seen to work together to remove barriers and accelerate the introduction of groundbreaking innovations that will transform care into the NHS. The scope of what we mean when we talk about innovations covers medicines, diagnostics, devices and digital products. And one of the really important things to us at the AAC is that we are actually developing research priorities and innovation needs that meet the needs of public and the patient public and patients and of the NHS. And SBRI is really pivotal to us in that respect. Next slide, please. So we've set 5 priorities for the next 2 years at the AAC, and I won't read them out, you can see them here. But what's really important really is to kind of point out that all these priorities, within them we have embedded a number of kind of clinical and policy priorities, one of which being to support addressing health inequalities, to think about how we align with the government's life sciences vision, but very importantly to us is to make sure that the work that we're doing from an innovation and research perspective is supporting the NHS's net zero targets. And throughout all our programmes we look at how actually we are addressing that, and how with things like funded programmes we can make sure that criteria and consideration for net zero is built into those. Next slide, please. So this slide just gives you a snapshot of all the different programs that we host within and deliver within the AAC. And really what we're pointing out in this slide is that we cover programs really along the whole of the pathway or pipeline for research and innovations, from idea right through to adoption and spread into the NHS. And you can see there in the middle of the slide that the SBRI programme sits really nicely right within that middle of that pathway. Next slide, please. And just to give you a snapshot of the work that we do and the impact of the work that we do. So we've got a considerable number of patients accessing our innovations across a high number of sites in the NHS. We are impacting patients in terms of the benefits to them. And you can also see, oh, could we just go back to the other slide? So benefits to patients in terms of fewer clinical visits and fewer days spent in hospitals. Obviously really important in terms of efficiency in the NHS and benefits to patients, but also if we're thinking about the reduction in travel mileage and the impact on net zero, then that's a really big impact that we are having. We work across the ecosystem, so we also have consideration for the economics of the work that we're doing and jobs created, and you'll see here the number of innovators and innovations that we are working with this year. And then on to the last slide, please. And really in this slide, I just wanted to give you a snapshot of the different types of things that the AAC does when we're thinking about our net zero ambitions. So Katerina's already said this is the second of a SBRI competition that the AAC has funded to support the development of net zero innovation within the NHS. But within our other programs, so for example, our Clinical Entrepreneurs program, we are embedding net zero and sustainability within that program and asking our entrepreneurs to really think about the impact of the work that they do and their innovations on the environment. And you will have seen recently in the press the news about the first drones to deliver chemotherapy drugs, and that work is actually stemmed from our Clinical Entrepreneurs program, and the company that is doing that is was founded within our Clinical Entrepreneurs program. We also across our programs, as I said, embed net zero considerations into our criteria, and just an example here in terms of the latest Confed Expo conference, we held a session to talk about how using digital innovation will deliver a net zero in the NHS, and lots of examples from our AI award were demonstrated there. So I am going to leave it there. Thank you very much for your attention this morning, and I will hand over now to back to Katerina, and we can hear more about this competition. Thank you.
Thank you very much, Lindsay, for this very useful overview. And if we go to the next slide, I'll introduce you to the next speaker now, who is Randa Tashdin, who is Senior Program Manager in the SBRI PMO, and she will dive into the details of this current competition and the SBRI Healthcare Program. So Randa, over to you.
Thanks, Kat, and good morning, everybody. So yeah, as Kat mentioned, I'm a senior program manager, and we'll be providing an overview of how the SBRI healthcare program works and just a bit more details on the specific competition. Next slide, please. Yeah, so about the SBRI healthcare program, it's an NHS England and Accelerated Access Collaborative program that is managed by LGC and supported by the Academic Health Science Network. And the aim of the program is to bring together businesses and government partners to address major unmet health needs and facilitate the introduction of innovations into the NHS. And it does so through the power of government procurement to accelerate that technology development and support innovations through stages of development, which are typically hard to fund. So the key objectives of the program are to improve patient care, increase NHS efficiency, allow the NHS to get access to innovative technologies that meet healthcare challenges, and finally, to create wealth opportunities in the UK. Next slide, please. So I mentioned that the program is supported by the Academic Health Science Network, which is a network of 15 bodies that was established by NHS England to support the spread of innovation and improve health and economic growth. We do have Pete Waddingham from the Yorkshire and Humber AHSN with us today, who'll be speaking later about the AHSNs and what they do in more detail. So please do stay tuned and learn more about the network shortly. Next slide, please. So looking at the wider funding landscape here in the UK, you can see that the way that the SBRI healthcare program has been set up is that it covers the entire translational development pathway from early feasibility all the way up until implementation and adoption. So it really fills in that gap, which is often dubbed the valley of death, between basic research studies where you usually have your council funded programs, and then late stage development where you typically see private investment. So to provide that support through stages of development, which are usually hard to fund. Next slide, please. I think I have to go to the next one, please. Thank you. So the program itself offers an excellent opportunity for businesses, especially early stage companies, to develop and demonstrate their innovative technologies. And the key highlights of the program is that it provides an early source of funding for companies, and it's a risk-oriented program. So it really allows companies and organizations to get up off their feet, de-risk their projects, and make them more attractive for follow-on investment opportunities. The program also has a simple application process and a quick turnaround. So again, allows organizations to get better accessibility to funding. And it also has links to many supportive networks, such as the AHSN, to support companies with the advancement and development of their innovations beyond financing. Next slide, please. So in terms of the key features of the program runs yearly themed competitions that are designed around unmet needs within the NHS. So it aims to address relevant and demanding clinical challenges. And although it's primarily aimed at small to medium-sized enterprises, any size business is eligible to apply, including NHS organizations and academic institutions, as long as the route to market has been demonstrated and as long as they're based in Europe. And the program is traditionally built upon a two-phase development approach, which includes phase 1 awards that concentrate on research and development that will prove the scientific, technical, and commercial feasibility of the proposed project. And these are worth up to £100,000 in net and last for 6 months. And if successful at phase 1, projects can then move on to more detailed product development at phase 2, which are worth up to £800,000 in net and last for a year. We do also offer phase 3 awards, which is a new award that we piloted for the first time last year and is a standalone award that is aimed to support later stage innovation with gathering real-world evidence and implementation activities. And these awards are worth up to £500,000 and last for a year. Next slide, please. So we don't have any specific entry criteria for phase 1 awards, but typically what we would expect to see is some proof of concept data that can support the development work, as well as the clinical needs and potential for commercialization. And phase 1 awards can be used to cover a range of different activities, including feasibility studies, prototype development, health economics, to name a few. So the types of exit points we would expect to see at a phase 1 are feasibility technical study completed, some market validation and business plan development, any kind of partners that are identified for phase 2, and anything around development of PPIE or health inequalities and the impact on that. In terms of a phase 2 award, we do expect phase 1 proposals to indicate what their plans for a phase 2 award would be if they were successful for follow-on funding. And usually a phase 2 would include further development and validation plans. So the type of exit points we would expect at a phase 2 would include a minimal viable product developed, early clinical evidence gathered to demonstrate the accuracy and safety of the technology, stronger commercialization or more robust commercialization strategies, such as the business model, pricing strategies, etc. Anything around health economics or evidence gathered towards regulatory documentation as well, or plans for implementation and adoption, as well as any kind of plans for further funding, if applicable, and stronger involvement and engagement with patients and members of the public. Next slide, please. So to date, to give you an idea of what the program has done, we've supported 265 technologies and invested over £109 million in those technologies. And if you go on to the next slide, you can see a few more metrics there. So you can see that we've had over 80 companies generate commercial revenue, 67 of which have had sales with the NHS, and over £600 million of private investment leveraged. Next slide, please. Our portfolio includes a range of different technologies that go from devices, digital health, diagnostics, and even service improvements. And to give you examples of companies we've supported, there's Innovator, who developed a laparoscopic training platform to democratize access to high fidelity laparoscopic surgical training. And through their award, they were able to get adopted by 8 deaneries and 2 multinational medtech companies, and have exported their technology to 4 continents. You also have BFB Labs there, who developed a digital therapeutic intervention to tackle childhood anxiety. And through their award, they're able to get CE marking and roll out their technology across 16 regions in the UK. Next slide, please. You also have Bridget Care there as an example of a platform for carer workforce. So through their project, they've engaged with 33,000 carers and now have a pipeline of over 20 organizations that they're working with across the ICS, social care, and acute community as well. They've also partnered with Microsoft and other social care organizations, and are fund launching for local authorities to also use the platform. And then finally, you have iPlato here as a last example, and they have developed a personalized patient care engagement network platform. So they have commissioned their platform across 45 CCGs, have been put onto the NHS Digital Assured app network as well, and have also merged with Huma Therapeutics, who have raised $250 million. So those are just a few examples of some of the companies supported and what they were able to accomplish with their SBRI awards. Next slide, please. With this competition, which is competition 22, as I mentioned earlier, the SBRI Healthcare Program runs themed competitions to address identified unmet needs within the NHS. And the theme for this competition is delivering a net zero NHS. So climate change is a health emergency that has caused more than 1 million deaths around the world. And air pollution is one of the biggest contributors to these deaths and increased health conditions. And although the NHS aims to provide high quality patient care, unfortunately, it contributes to around 4% of UK emissions, so is both part of the problem and the solution. So in 2020, the NHS became the first health system in the world to commit to reaching net zero with two main targets: to become net zero by 2040 for emissions that the NHS controls directly, and to become net zero by 2045 for emissions that the NHS can influence. And the NHS have taken steps already to achieve these targets. So since 2010, they've reduced emissions by 30%, thanks to steps that they've taken across the workforce. However, there is more that can be done. So there's more transformation work to be done to improve the quality of patient care whilst also reducing carbon emissions. So there's a big need to develop technologies that can address this problem and accelerate action. So in partnership with the Greener NHS and AHSN network, we've launched this competition, which is our second net zero competition that seeks innovative solutions that focus on decarbonizing clinical pathways that are the most carbon intensive, which will require change across the whole care continuum, including early disease detection, accurate diagnosis, and more targeted treatments to cut those emissions. So the ambition is to find solutions that will reduce carbon emissions across 4 challenge areas, which is 1, decarbonizing surgical pathways. So as you may know, many surgical pathways are high volume and carbon intensive, such as operating theaters. So there's a strong need to streamline and decarbonize those pathways for better efficiency measures. The second is reducing waste in surgery and critical care. So the NHS produces a significant amount of medical waste each year. So alternatives for things like single-use items or disposable items are required to really reduce that environmental impact. The third category is net zero personalized care. So there's an increasing complexity of people's health needs at the moment, and it's just apparent that a one-size-fits-all healthcare system won't meet those needs. So personalized care is becoming more and more important, and it's important that as we move towards that direction, approaches that consider sustainability and reduction in carbon emissions is considered. And then finally, tools to support workforce to deliver net zero care is the last category. And that's all around making sure that we can provide the NHS workforce and policymakers and leaders with the sufficient support to help them build sustainability principles into their business as usual activities. So those are the 4 challenges we're seeking to address in this competition. And we're looking for innovations that can respond to these specific challenges. And we have Dr. Nick Watts, who will talk about these challenges in more detail shortly. But you can learn more about these challenges, which are described in detail in the competition challenge brief, which is published on our website. So please make sure that you take a look at the brief to really understand the scope of this call. And then finally, for my last slide, if you go to the next one, just the key dates to consider. So the competition will go live on the 24th of August, and the deadline to submit applications will be the 5th of October. The assessment period will take place over October and November. We're expecting panels to take place in December and projects to commence by January. And all of this information can be found on our website. So again, please check out the website and keep a close eye on it for any updates. But that's all from me, and I hope you're able to get a better sense of the program and how it works. There will be a Q&A session shortly, so I'm happy to take any questions then. But for now, I'll pass the floor over back to Katerina, who will introduce Nick Watts. Thank you.
Thank you, Randa. And not much left for me to do, but just to introduce the next speaker, Nick Watts, who is the Chief Sustainability Officer of the NHS, which means that he leads the Greener team and basically is responsible for the NHS commitment to make our health service a net zero emissions soon. But before I move to Nick, I just wanted to remind you that, as Randa said, there is a Q&A session coming up shortly, and not all our speakers will be able to stay the whole day, so the whole session, I mean, so please do fire away questions that you have for our speakers if you can. Over to you, Nick. Thank you.
Thank you. I'm going to be brief because the Q&A sounds fun and because you don't need to hear from me. But I need to correct something. I need to correct the record. You said that I was responsible. I'm the Chief Sustainability Officer, correct? But you said I was responsible for the NHS hitting its net zero target. Not true, nonsense. All 1.4 million of us are responsible. I'll let you know when we get there. We'll have the analytics, we'll have the funding, we'll have the political momentum, we'll have the levers, we'll make sure the enablers of change are in place. But we're only going to get there if all 1.4 million of us make 1.4 million low carbon, sustainable, high quality clinical decisions every single day, every single year, going forward through to 2045. That's the only way this happens. That is why this call matters. That's why it's so damn cool to see 160 people show up. 160 people with, I bet you, more than 160 ideas of how we can transform the NHS. Look, it's all been said. There's 3 good reasons why you should care about climate change. Number 1, it's damn scary. 1.17 degrees. Global average surface temperature rise is 1.17 degrees above pre-industrial average. The trigger point for runaway climate change that we get worried about is 1.5 degrees. We have a 50-50 chance of hitting that in the next 5 to 6 years. This stuff's getting pretty urgent. For the NHS, we have seen firsthand what the hell that means, and it gives you a really good sense of why we would care about it just as much as we do. These numbers aren't quite public, but you'll forgive me. 8,700 deaths from the recent heat wave. Normally, in the United Kingdom, we face about 2,400 across the course of a year. This was over the course of a couple of days. That's what happens. That's what extreme heat, the health impacts of that on an already ailing heart, on chronic kidney disease, taken on a new AKI. That's what that looks like. The NHS cares about this because of the health impacts of climate change. But frankly, we also care about this because we know that it's just good common good common sense healthcare. We know that the response to this, because it's been said, 30% the NHS has run at this at. Every time we've done this, we have seen our costs go down. We have seen that sustainability, quite frankly, brings one of the best returns on investment you could possibly ask for in a healthcare system. And God, the events of 2022 and the energy efficiency demands on the NHS are making that even more apparent. The third reason is there's 160 of you guys that have shown up. That reflects what we know to be true. 9 out of 10 of the NHS's 1.4 million strong, 9 out of 10 of our friends, our colleagues, care desperately about climate change. They want to work, and we go and ask them every quarter, every 6 months, sorry. They want to work for an organization that is living up to their own values. They want to work for an NHS that is tackling climate change 91%. The demand is clear. The response is damn clear. You run it as fast as you possibly can. 2045 for the NHS. The second we gain confidence that we are going to hit that, we're going to move that target forward, because you run and you run and you run in response to an emergency. We've made good progress so far over the last 2-3 years of some of that running. We've hit our first year reduction target. I promise you we're going to hit our second year reduction target as well. How have we done that? We've invested heavily, and that investment has already started to pay for itself. £677 million out into low carbon healthcare, hospitals, primary care estate across the country. We have innovated. the world's first zero-emission ambulance and the world's second zero-emission ambulance, the world's first net zero operation up in Birmingham, kid born using net zero gas using a clever harvesting machine up in Newcastle end last year. We've been bold with our procurement. We've been clear within the decade, the NHS will no longer purchase from anyone that does not meet or exceed our commitments on net zero. And we've been very clear about precisely what we mean and where those qualifying criteria for doing business, quite frankly, with the NHS start to come in. But what you hear with all of that, when I talk about this, is you hear we're making progress in a couple of really great areas, but frankly, we don't have all the answers for everything that has to happen from 2022 through to 2045. And there are some areas where we know a lot. We know a lot of what we need to do with what we call our fixed and our mobile assets, our built environment, our ambulances, our electric vehicles, our hospitals. We know a lot of that. What we don't have enough answers on yet is what this looks like clinically. What happens when you go and show the net zero strategy? It's only 68 pages, don't worry. It's a long technical annex. When you go and show the net zero strategy to a cardiologist or to a renal nurse or to a physiotherapist out in community, and you say, hey, what does this mean for you? What does this clinically mean for you day by day for you and your patients? There, I think we need more answers there. We need more innovation there. We need help from 160 EU. You could cut this up 1,000,007 different ways. You'll see in this particular call, we're focusing on surgical pathways, we're focusing on waste in critical care and in the operating theatre, on personalised care, on social prescribing, on thinking seriously about making sure that the care that our GPs, the care that our clinicians are providing is the highest quality care, not just the highest technology care. And on empowering our staff, because I might end where I started. This stuff only happens if we get to the point where not just a chief sustainability officer, no, indeed not even just 160 of us, we're all 1.4 million of our healthcare professionals are pulling in this direction, making 1.4 million low carbon, high quality care decisions every single day. I'll end, but it's worth saying that it's worth talking very briefly about the things we're excited about. We are excited about things that directly improve care for patients. We're excited about things that empower clinicians, that let people have a crack, let people learn something, let people take this journey on for themselves and interpret it down at the local level, down at the coalface of what it means to be a clinician. We are excited about things that can scale. Of course, we are excited about things that directly tackle climate change, directly reduce our carbon emissions. And we're excited about things that do that when you consider the full spectrum, when you consider all of the counterfactuals, all of the different ways that a patient could have moved through the system, all of the different products, everything we could have otherwise provided. Those are the kinds of solutions that we're looking for today. With Lindsay's help and Lindsay's team, we've had quite a lot of exciting success over the last year with the first competition, learned a lot. I think I'm damn excited to see what comes next. So I might stop there. If there are any questions, I can certainly take some, but I think you have a panel later on, so why don't you move me away?
Thank you very much, Nick. And yeah, apologies. Nick is not going to come over to each trust to remind you what to do to act sustainably, but definitely you gave us an inspiring overview of what the vision for this is. So thank you very much for that. And I was just having a look. We have questions building up. I was wondering to give you some more time to ask your questions. Before, we were supposed to have the Q&A session right now, but I was wondering if we wanted to go first into listening to the next talk, and then we have the Q&A, so that we give you more time to come forward with questions. So I was going to introduce our next speakers first, and then we have the Q&A session. So the next talk will invite two of the successful applicants of our previous competition to talk about their experience and share their wisdom with us, their do's and don'ts for all the people that are planning to apply now. Firstly, we will hear from Dr. Tom Dawson, who is the founder of Revolution Zero, and then Nathan Moore, who is the founder and director of Primum Digital Limited. So over to you two, first Tom and then Nathan. Thank you.
Thank you, Katerina. Can you all hear me okay?
Very well, thank you.
Yeah, thank you, Katerina, that's great. So yeah, my name's Tom Dawson. I'm the founder of Revolution Zero, which is all about displacing single-use medical textiles with net zero focused reusable alternatives. And it's great to be engaging with you all today and to be part of this program. Today, I'm going to give you a brief introduction to our project, along with some information that will hopefully help you put together a successful application. My contact details will be at the end, so please do not hesitate to make contact after this. So we were fortunate enough to have secured phase 1 funding for the first net zero competition. Our project has focused on decarbonising orthopaedic large joint replacement surgery. Very specific, but that has been through replacing single-use drapes and gowns with more effective and sustainable reusable products and systems. It is specific, but however, spreading this out and scaling it up across UK surgical specialties, we have potential direct financial benefits of £50 million, with savings of at least 100,000 tonnes of carbon, 4 billion litres of water, and 25,000 tonnes of waste. Now, those savings are great to equate to a further more than £33 million in indirect savings. So next slide, please. Okay, it's still on the, okay, great, wonderful, thank you. So I think with reference to what I've just said, probably the most valuable piece of advice I can give all of you is that you must fully define your value proposition. You need to be able to present it and defend it to absolutely anyone. If we can go back to that last slide, ideally. Some slide games here. And when I say present and defend it to anyone, I mean your 8-year-old niece, or the cynical university professor who has, until you speak with them, of course, dismissed your idea and your area is completely ineffective and irrelevant. It must be highly defendable. So you must be able to communicate and defend. It needs to be simple and also emotive. It needs to be exciting. It doesn't, not dry. We have to do something. This is a major challenge. So define the why you're doing it, the what are you doing, how are you going to do it, and make it really exciting. It should be stirring the emotion of how are you going to save our world with your solution. You need to be able to back it with thorough analysis. You need to be able to look at your competitors, current competitors, emerging competitors. Your points of difference need to come out really strongly, and analysis, economic analysis, carbon analysis, environmental analysis, and do not forget social analysis and social impacts. It's not just about carbon. This is a net zero program, a net zero focus, but there's a whole lot of things that add up to that. Also, be really ambitious. It is NHS focused. However, remember, we have a world to save. This is a global problem. The NHS, thankfully for us, are leading the way, well and truly leading the way. But we do have a world to save. So think about the wider picture, think about transferability, think about export markets. Also, commercial strength is absolutely critical. Without money, you will not be able to fund the engine. The engine has to drive these challenges and drive these changes forwards. Also, know your barriers, know your regulatory barriers, and keep talking to people. You might be surprised about what additional regulatory barriers that exist. And there's also lots of other barriers. In saying that, there will be plenty of people who will come up and say, no, this is too big a challenge, can't do this because this, the what if brigade. However, in this program, more than 90% staff embrace sustainability, NHS staff. You'll find plenty of places to go where you're loved. Go to those places, work with those people. This is not something that we do to the NHS. We are doing it with the NHS. Collaboration and partnership are absolutely critical. Next slide, please. So one of the other things that's really important, this is an amazing opportunity. It's a real chance to put yourself and your organization and your innovation on the map. You have wonderful support. The PMO team has been really good. The Net Zero team, you can talk to people. We've got expert areas within here. Also the wider community, including the Academic Health Science Network. We'll be hearing from Pete soon, who's supported and been wonderful about singing from the rooftops a number of healthcare SBRI Net Zero projects. And also it's a great chance to grow your team, bring in international experts. They really come in, really come in and gravitate to this program. At least we've found that. You can build up your direct and also your indirect partnerships within the NHS, but also within supply organisations, develop all sorts of different partnerships going forward. It has rapidly accelerated commercial growth for us. In the last month, the March of last year, we had the equivalent of a whole year of forecasted revenue come in and land just on the March. And a lot of that was due to this program. It also rapidly accelerates technical growth. So really think about these wonderful benefits you have. Communications and networking, rather than giving 2 conference presentations every 6 months, we ended up giving half a dozen. We've increased our followers on Twitter by greater than 1,000 and also increased our LinkedIn followers by greater than 400. Some very, very real tangible benefits. Next slide, please. So when I'm saying be ambitious, you also need to be very focused as well. So this is our system moving forwards. However, the net zero focus of this was really just on the reuse or the reprocessing pathway. So there's a small little bit there on the bottom right, which we really focus for this. We've got a whole lot of other work to do and a whole lot of other work to go forwards, but take your minimum viable product, take it, grow it, show its feasibility and how that applies to your wider ambitions and wider scalability going forward. And final slide, please. And again, as I said earlier, thanks for being part of this community. It's a very important community. We have a world to save. My contact details are here. Follow us on Twitter. We'd like another couple of followers and make contact. Happy to ask any questions and great to hand over to Nathan next. Thank you.
Well, thank you so much, Tom. Can everyone hear me okay?
Yes, Nathan, go on.
Yeah, brilliant. Absolute privilege to be talking to you all today. I'm Nathan. I'm a frontline clinician by background, an orthopaedic reg, an NHS clinical entrepreneur. And I founded Prime Digital Limited to try and deliver on some of the challenges laid out in the long-term plan. Next slide, please. So our solution is called Crosscover. A bit like what Nick Watts was saying about solutions that help transform the whole care pathway, our system is designed, it's a web application to help the NHS deliver system-wide optimized pathways of care for patients that are clinically effective, cost-effective, and as net zero as possible, right into that core workflow of all staff. So essentially, patients get the best care first time and every time. Some of our achievements are being able to reduce outpatient appointments by about 50%, increasing best practice happening first time from status quo about 30% up to over 90%, saving about £100 per patient and saving about 3 kilograms of CO2 per patient. Next slide, please. So what our system really is a DevOps system for clinical pathways. So we help NHS trusts and integrated care systems design, build and test sort of ICS-wide pathways of care using best practice that's published at national level, but importantly deploy it in a way that meets government's requirements and operationalize it right into that core workflow. So no matter where you are in the care journey with the patient, every patient's getting given the same best practice advice at all times, really to get that most clinically effective and cost-effective pathway. Next slide, please. So what are the benefits of the awards? Multifactorial. There literally isn't a reason not to apply for this award. You're going to get independent, if you do win it, independent validation that your crazy idea you have that has been reviewed by 30 plus other people, they think you're not crazy, and it's probably worth some public funding to see if it's going to work. So it's an indicator of potential. Lots of you will be looking to VCs and external investment. And what's a better indicator of potential than this sort of award? I suppose regular revenue from a regular revenue stream from buying customers is better, but this is still another string to your bow. Every time you try and deploy your solution, whatever it is in the NHS, you're going to have to win a business case to get it in through the front door. And this will add to that business case. You'll find, just like Tom said, opportunities open up to you. So with NHS partners and other organisations as well. I don't know about Tom, but I found just completing the form was really useful because you consolidate lots of your ideas. You answer the same questions that every trust is going to have to answer in their business case. And you find you really make it quite a coherent value proposition. And you can reuse that in multiple award applications, grant applications, presentations. It's just a useful exercise in itself, filling in a form. Next slide, please. So a few tips to applying. We've been fortunate enough to win 2 of these awards so far. Essentially read the brief, try to formulate what are the challenges you're actually trying to address. Really form that compelling story. So you have to picture it that you really have fallen in love with your solution, but not everyone else will have. And you need to get across that story you're writing down, an external person reviewing it with no knowledge understands what you're trying to do, why you're trying to do it, and has an appreciation of will it maybe work. So on that note, you really want, once you've formulated your grant application, is get everyone to read it. Get your friends, your family, clinicians, non-clinicians to give you feedback. Once they've read it, do they actually understand what you're going to do? Does it make sense to them? You'll learn a lot from that. And it's so important. We're trying to deliver a net zero NHS, but the day-to-day struggles of clinicians and managers is dealing with their pain points day-to-day of being under-resourced and understaffed. So if your solution's going to be used in the NHS and procured, you really have to win that business case and address the clinical and cost effectiveness of your solution. So you can use, or in your application, put in for work packages like health economics assessments to help you build that all-important evidence base to address clinical and cost effectiveness, as well as carbon effectiveness. I would say that lots of you may already have minimal viable products, but those of you who don't, for your minimal product, you really want to make it minimal and get it tested as soon as possible, because I guarantee you lots of the assumptions you've made are wrong and you're going to need to pivot. And when I say minimal, I mean the thing that separates you out from the herd. That's what you need to test. And then for viability, it's got to meet the regulatory requirements, which can be quite comprehensive, but this can help you address that. Next slide, please. So lessons learned, so important to win hearts and minds across the NHS. You will get people in the NHS that just think your idea is brilliant. They'll come up to you and you need to do everything in your power to support those NHS champions. You need to arm them with the evidence they need to go off and win hearts and minds all over their organisation. I don't know how Tom's found it, but you can't make a system-wide implementation of a solution unless you've both got top-down support and bottom-up support. So you're going to have to be agile as your plan evolves and the landscape changes, and always try and have a plan B. Your 6-month project may hit issues that you didn't anticipate, but you've got to have options to deal with any sort of uncertainties that come along. Next slide, please. So SBRI and NHS England supply these workshops, which are great to help you along your entrepreneurial journey. You do get direct access to the NHS Arena team, so you can see how strategically they're trying to address these issues. The SBRI PMO itself will give you a grant manager who has a wealth of experience managing multiple companies like yours, and they can help identify gaps in your value proposition, which I found quite useful. I have to say that NHS customers are an amazing partner. you really should try and get one. And on your product development team, you really should have clinicians as well, because they'll provide insights that you just won't, they'll provide, you'll be unknown unknowns will be made known to you. So I would say that overall, the support we've had from SBRI has probably accelerated our innovation about 5 years, which has been fantastic. Next slide, please. So anyway, thanks everyone. My details are up here. Just like Tom said, I'm happy to answer any questions, etc. But thanks very much and good luck with your applications.
Thank you both. And if actually, Nathan, if you don't mind to stay on camera, if you can stay a little bit longer, I wanted to bring in now back also Tom. And I think unfortunately our clinical presenters, our specialist presenters had to log off, but we can address anyway some of the questions that are building up in the chat. And if Randa, you can come as well back on, because there are some questions for the PMO. I think we can go on to that, because there are also some questions that you, Nathan and Tom, might want to comment on. So there are lots of comments that span out from the conversation that Nick had, and actually there is one point about no mention made of saving patients traveling to clinics or hospitals. Actually, Randa, did you want to comment a little bit about how this is actually potentially relevant and in scope for this call? So saving traveling to the NHS. Do you mind?
Yeah, sure. So I think the biggest element of travel impacts and how that could address some of the care miles associated with that would probably be through the personalized care category, because, you know, with personalized care, we're trying to move the kind of control and power of a patient's care and health into their own hands, and kind of moving it away from hospital settings into home and community care settings. So a part of that will contribute to those care miles and the reduction of travel between people's homes to primary, secondary care settings. So that in terms of the categories, if they were trying to look for specific ones, it would probably fall under that area. But one thing just to note is that excluded as part of this competition is anything around the actual transport of things, so like the fleet and infrastructure of travel. That's not something that we're considering, but yeah, anything around care miles would probably fall best under the personalized care category.
Thank you. And I see actually we have on the line still Julia Farrington from the Greener team. So Julia, would you mind to also chip in this conversation?
Yeah, absolutely.
Thank you.
Yeah, I'd second everything that Randa has said as well. I think surgical pathways as well, there's a focus on kind of that pre-operative assessment too, which could save some care miles to kind of those and streamlining those appointments for tests and procedures as well. So
thank you. And yeah, if you don't mind to stay on, if there are any questions related to scope, I will also refer to you. Thank you. And I have seen a question that was quite interesting, probably for both our previous applicants and also the PMO can address some of it. And it was about bringing examples and learnings from the previous competition. So I think you, Nathan and Tom, addressed some of these points, but if you can distill one sentence each on these, and then I will maybe ask the Greener team to chip in from their point of view what they thought the main learning from the previous competition was, that would be great. So Tom, you are muted first.
Certainly. So happy to go for this, and I think this is actually going to reinforce the point that Nathan made as opposed to I made, and that was around contingency. So really, you not only have a plan B, but have a plan C, a D, an E, an F, and that works really well if you actually collaborate across multiple NHS partners, have multiple NHS partners, and also think outside the box. An example of this is we're also engaging with NHS Wales, and as a result of our engagement with NHS Wales, on the back of winning the SBRI, we were able to actually deliver most of our deliverables in Wales before we delivered them in England. So we're really happy about that, but it also shows the scale and spread. So this was a big advantage of having multiple mitigations across there, and yeah, really useful. So yeah, please do that and talk to everyone and get lots of support.
Thank you. Nathan, anything to add on this?
Yeah, I mean, our particular innovation is kind of herding many cats together from many organizations. So you can imagine project management was super important to be all over it and be very organized from the beginning. I think also what's quite useful for anyone doing these innovations is that really try and work out what are the key performance indicators that your target customers are going to measure against, because it may not be what you think. And inevitably someone in a decision-making capacity who has either green lights or doesn't green light your particular solution is going to want to see those particular KPIs get affected. So you've got to really tap into that, into how your particular solution, whatever it is, really resolves the pain point your target customer has. And I think we have a situation, you know, Katerina, that our solution, the customer is different to the end user, because you've kind of got the end user engagement as clinicians, but the people that make decisions are sometimes never met a patient. So it's yeah, I mean, it's hard to give generic advice when I've got very specific kind of issues with our solution, but hopefully what I've said has been helpful.
Thank you, Nathan. Yes, it has been, I think. And then Julia, do you want to add something from your perspective?
Yeah, just to echo what Tom said in his original presentation, which was that like carbon quantification is obviously a really key part of this challenge, as is kind of assessing your impact on supply chain and kind of procurement, life cycle analysis, all of that fun stuff. So make sure that you're including that in your proposal and thinking really hard about it. There are a number of resources and tools that are available and also coming out. So yeah, the links with the NHS trusts and AHSNs will also kind of help you to identify those tools to help you with the application.
Thank you. And Julia, I think that there is another couple for you here. People are now asking about eligibility, and Randa also, if you want to chip in. One question is about sustainable material innovation. Is it in scope, like biomaterials for PPE or single-use items? So are you okay to give a start on this?
Yeah, of course. So I think there is a specific challenge or sub-challenge around minimizing the amount of waste generated in surgery and critical care. I think if you can prove that you're reducing the content of virgin or carbon intensive materials used in the products, that could potentially be in scope. However, I would stress that you need to ensure that you're proving that it will have an impact on critical care and surgery. So it needs to be specific to those areas. But Randa, I'm happy to hand over to you if you have anything to add.
No, I would echo what you just said.
Okay. Thank you. And I think linked to that, there is something about a question from Helen asking if is the competition only focused on reducing waste, and is there any scope in waste recycling? So do you want to comment on that, Julia?
Yeah, of course. So yeah, I think there is something in there around recycling. So like, you know, your new approaches to repairing or reprocessing as well. But it's also about kind of supporting suppliers to kind of think about how they might improve their recyclability. But again, I think it would be around kind of that minimizing the amount of waste, improving the content of virgin or carbon intensive materials, and increasing the proportion of recycled materials as well.
Thank you very much. That was very clear. And I think there is another question about there was something, well, there are actually, the conversation has instigated lots of comments, and I like how you're answering each other's questions too. So that's really interesting. But there was a particular question on allowing more staff to work from home. If that could be something that also fits the bill for this particular call. What's your view?
I think it's a tricky one because obviously, like many clinicians, have to work face to face with patients. But I suppose, and also I guess my concern would be that there are probably a number of mechanisms already that kind of support working from home. But if you can prove that it's kind of novel and I guess innovative and is kind of helping clinicians and staff to provide net zero care, then I would assume it's in scope. But yeah, happy to be challenged on that.
I think, and also to remind the audience that you can also ask more detailed questions. You can send us inquiries through our inbox if you want to disclose some more confidential information to look at eligibility more in detail. But thank you, Julia. And I've seen another interesting question. I think it was more for the PMO at some point. About IP ownership. Randa, would you mind to remind this audience what the IP ownership terms are for the SBRI healthcare program?
Yep, so under the program, all IP ownership is retained by the innovators. So we do not ask for any kind of ownership rights over IP. However, we do get certain usage rights through the contracting organization, which is the NHS. It's an NHS trust that you'll be contracting with. And that is just mainly around ensuring that there are patients to benefits and kind of anything around research outputs that can be used to benefits and ensuring that those outcomes are kind of appropriately put into use, as this is public funded programs. So with the IP ownership, it does reside with the innovators, but there are certain usage rights which you can see through the contract, and there is a template of the development agreement on the website if you did want to see the specific clauses around that. But yeah, that's just how it works.
Thank you very much. And now that I've given Julia a break, we have another question about eligibility. And it's more right if we could actually give an example of a product that would suit well the net zero personalized care category. And then there was a conversation, for example, about e-cargo bikes, if that would work, and if this is for the district community teams to use to get patients rather than petrol, diesel, or these sort of things. Do you have any other ideas of what you're looking for here?
I guess it's almost those devices or like new technologies that are really going to support patients to manage their care at home, I guess in an easier way, but also feeling like they're like well supported while in home. So particularly like, new ways to monitor diabetes, for instance. So not just an app, but like another way of doing it. I mean, I know that there have been a number of kind of ways to kind of track your diabetes, but like almost new approaches or almost improvements on those as well. And also, of course, ensuring that any approach is considering and measuring that carbon quantification as well. That's a really key component. The e-cargo bike sounds like a really interesting initiative. However, I know Randa mentioned that transportation is out of scope, so I'm not entirely sure if that would fall under it. But Randa, what do you think?
Randa, do you have any comment?
Yeah, I think that exclusion criteria was more around things like the actual transportation vehicles like ambulances and other kind of fleet structures that are used because that is something that is already taken into consideration by the NHS, and there's work around that that is being done separately outside of this specific competition. So the focus would be just more on innovations that can support that reduction of care miles without necessarily focusing too much on the actual transportation vehicles that is currently in place.
Okay, thank you. And I see we have another Q&A session at the end after the last two presentations, but I wanted to bring forward just one more question about more eligibility. So in terms of waste, the call talks more about hard and on one-use plastics. Are other waste flows of interest, and for example, wastage of equipment? Julia?
Yeah, I would say absolutely, particularly surgical and critical care equipment. You know, reducing the amount of waste of these types of equipment is, I think, one of the really key parts of this competition. So we're looking at ways that we can safely reuse surgical equipment. So that could be, you know, improving approaches to sterilization. It could also be about reprocessing, repairing, all of those things. So I think equipment will be a really key part of this. Absolutely.
Thank you very much. And just also wanted to move on to the next speaker, but just say we have another Q&A session at the end. So the questions that have been unanswered so far might be answered then. Okay. But thank you so much. If you can go off your cameras for the moment, and I will invite our next speaker. If we can go to the next slide, please, Alice, which is Pete Waddingham, who is a program manager at the Yorkshire and Humber HSN, and we'll talk about the support that the Academic Science Network can provide to innovators. So over to you, Pete. Thank you.
Thank you. No, well, thanks for the invite. And if we just go to the next slide. Yeah, lovely. Well, I'm glad. I was going to apologise first, actually, because I am currently the programme manager for the Yorkshire and Humber HSN, but I do take up a new national role in a couple of weeks with the HSN network, and I'm going to talk about the HSN network, but this presentation is branded as Yorkshire and Humber, but that's because I currently work for them. And as I said, really privileged to speak today. A nice order as well. I always enjoy listening to Nick Watts, Tom Dawson. Thank you for the shout out, Tom, and I'm sure I'll return the favour in my presentation. But really inspiring, great work that's happened so far, and hopefully I can just give you a quick flavour of some of the work that we can help you with and support that. Lovely. So I'm just going to do three quick things, really. I am going to give a quick overview of the HSN network. I know it's been mentioned a couple of times on this call, so I'll be very brief. I think we're all biting at the bit to get this competition up and running and get some of the innovations in as well. So the sooner I rattle on, the better. I am going to give, and I put the word small flavour in there, because the HSN network are doing some great areas in sustainability, and I'm only going to bring to life a few of those just because of time. But I'd love to connect with you, and I'd love to make sure that we can tell you more about our work. And then lastly, I'm just going to give you an overview of the areas of support that we can help you with. Thank you. Next slide. Lovely. This map has already been shown, but yes, we are a network of networks, and there are 15 of us up and down the country. And at the moment, I work for the Yorkshire and Humber version. And as I said, I'll be taking on a national role, but we are well connected on this agenda and many agendas. We're often seen as we knit the system together, including ourselves. And hopefully I'll give you a bit of a flavour as we go on through this presentation. Next slide. So just in terms of the, as a strapline that I often use, we're often seen as the innovation arm of the NHS, and we try and find and spread innovation at scale. And I think, as probably people have alluded to already, that's not an easy challenge. There's some great innovation out there. I think we've got lots and lots of solutions, and certainly I've been privileged while I've worked in the HSN for 4 years to see some amazing innovation, lots in the digital space, but many other schemes and projects. And hopefully we can be the catalyst for that innovation, and we do connect partners and try and create that environment for spread and adoption, which, as I said, is not easy. Next slide, please. So as well as being a network of networks and working on a regional basis, all of us as HSNs are embedded within our local communities. We've got some really good relationships. Again, I came from the NHS. I spent 10 plus years in the NHS, so that's always a help. But I've been working with a lot of people on subjects like cardiovascular disease across West Yorkshire and across Yorkshire area, and obviously on environmental sustainability, we've been doing lots of work. So we're well connected to our local systems. There are lots of different changes. Obviously, we've just moved to integrated care boards and lots of kind of local groups that set up. So, for example, within Yorkshire and Humber, we've got some new digital hubs and innovation hubs that have been set up. So we like to think we've got the finger on the pulse. There's lots of changes, lots of forum, brilliant people to connect with. As Nick said, 1.4 million workforce. And I'd like to think us as HSN networks have got some of those really good connections. Next slide, please. just been a little bit slow, isn't it, on catching up? And to be honest with you, I can't remember what my next slide is though. Yeah, I've already said this, so we can move on. We already touch and connect nationally. And yeah, we've got a sustainability community of interest. In fact, we met yesterday, really good group, some brilliant shared learning events. I hope we can bring to life some of the work that you're doing and previous SBRI companies have done, and we have done that already. In fact, we just did a shared learning event on waste maybe a couple of weeks ago, well over subscribed. We've done ones on asthma care, etc. So please do connect with us as an NHS network. As Tom said, and as I'm going to talk to in a minute, you know, social media is a brilliant way to do that. Connect with us, reach out to us. You'll see what we're doing, what we're up to, and I definitely think you'll find it of interest. And we love showcasing that innovation. Next slide, please. And again, just a sort of token nod to show that we are actually part of the NHS Net Zero plan. You know, we're well embedded in there as a go-to organisation to help embed this, and that's a real privilege to be able to carry that mantle, and I hope we can do it justice in the coming weeks and months. And as Nick said, you know, we've got to start running at this. This is urgent. I only have to look out the window now. I can feel the heat on my face. It's hot out there. We've got some extreme weather. This challenge is serious. So yeah, we're well embedded within the net zero strategy, and hopefully we continue to work with Julia and all of you on that call to connect this agenda together. Next slide, please. Just a little flavour of some of the things that we do. We obviously work with companies right from the idea stage, right through to sort of spread and adoption and everything in between. And as I'm going to talk to you in a bit, we've got various help along the way. And some of those ideas, as you can see in the diagram, they don't always make it through to the end, and that is for various reasons. But you know, we're definitely working across that entire pipeline spectrum, and again, that's brilliant. I mean, I'm currently involved in projects around AI, and again, I mean, we've got lots of AI in the world at the moment, but it's still fairly new. It's, you know, it's a good tool that I'm fairly confident will help us in lots of areas, and certainly net zero being one of them. Certainly when we've got such big complex data sets, numbers, problems, when we've got a complex problem, that's where we should be looking at AI, and actually looking at green AI, which we've been doing some thinking about as well. So next slide, please. Thank you. I don't know if it's jumped over one too many. Actually, I've lost my screen there. Sorry, yeah, it kicked me out. I'd love to give a shout out to every HSN up and down the country, but I can't do that just in this short time. But I thought I'd just bring to life Eastern HSN, work very closely with them. They're doing some great work, linking with tech innovation. You can get in touch with them. They've got a great offer of support, as of all the HSNs. So I just wanted to give a flavour of how you can start thinking about, if you're not already, connecting with potentially your local HSN. We're not geographically bound. You know, we've got companies that are not within the Yorkshire footprint, and I actively work with, and vice versa. So, you know, use your own judgment. Reach out to me. I can connect you if you need me to do that as well. But Eastern have just launched this support for tech innovation. So it's on their website, Eastern HSN. Next slide, please. And again, West of England have done a similar thing. So again, if you're in that neck of the woods, or you just want to check out what their support they're offering as of now, please do that. And again, that support is free. It's really timely for this SBRI challenge. You know, use them, help them, use them so that it can help you with any bids that you may put in. Next slide, please. And again, it'd be rude of me not to give a shout out to the Yorkshire Number HSN about some of the work that we've done and are doing. So we launched the Propel Net Zero scheme. So Propel is our digital accelerator program. We've done lots of sort of masterclasses and briefing. There's more of them on, and Propel is coming around full circle again. So we're just about to launch that in September. So if you're following us on social media, you'll see that and how to register. Next slide, please. And we're about to just implement something called Digital North. And again, what we're really keen on with our Digital North Accelerator program, which is a collaboration between 4 of the Northern HSNs, is let's get green innovation embedded within that. So this is active to support to around 6 to 8 companies that we know are already have some sort of traction in the North that we want to go further and faster at. And as I said, we've embedded sustainability into that agenda. Next slide, please. Just a brief shout out. I mean, I've already said this about how we're well connected. This is just a personal bookmark that I keep, but we are really, you know, I like to think there's so many brilliant resources out there. I think Julia mentioned it as well about carbon quantification. I've been pulling all this together for my own sanity, and I use a bookmark, and people are welcome to have access to that. You know, it is just an informal list, but you know, there's some real gems in there of some quality information, and that's what we need to be able to do. We need to be able to put our finger on the pulse quickly. To find the things, but as I said, use your HSNs to help you connect, to help you do that thinking, because you know there is a lot going on there, and we've done some of that thinking. So don't struggle alone. Just reach out to us, ask that question, and don't, as I said, don't be frightened to ask. Next slide, please. So yeah, just some final personal reflections from me about the HSN support. And I say personal, just I've been in this role supporting innovators in the last sort of 3 years. But a lot of this is probably already been said, which is good because it's a bit of a sanity check for me as well. But funding, there's lots of funding out there. Obviously, this SBRI is one of those sources, which is fantastic, but there are others, and we have funding bulletins that you can sign up to. We support innovators with their applications, including finding partners. Again, it's not always easy that, but you know, we do strive to support and help you with those other funding sources. Again, if you're putting in a bid, we might make some review and suggestions on areas to improve and expand. I think Tom spoke about this, and I think as well, Nathan as well. Get your USP in order, your business case, you know, your proposition, and we often talk about that in the HSN. Help navigate the regulatory framework. Again, there's new standards come out, new requirements, and you know we're well placed to help you with that thinking. So don't struggle. As I said, you know, reach out to us on any of that. Yeah, connecting with people, building relationships, it does take time. I mean, I really like Tom's phrase of go where you're loved, and you know, that is sometimes the nature, but we've built some of those relationships, and as I said, there are many to consider. So you know, let us help you to make them as well. We're always on the lookout for real world evaluation contenders. You know, if you're in the trust already and you want us to support about how we could evaluate your innovation, so you've got that independent evaluation evidence, please do reach out to us or your local HSN. Again, it's been mentioned, but you know, I wanted to bring this to life. A critical friend, having those honest discussions. Now, I'm sure Tom would agree, but I've spoken to Tom over numerous years, and sometimes we like to play devil's advocate. You know, we like to, you know, get you to think about some of those perverse incentives that might be in the NHS. You know, we've got great solutions, and if you're not quite close to it, it's hard to understand. So yeah, we just act as an honest, critical friend. Sometimes I say to companies, I don't mean to sound negative. I'm doing this purely for wanting to see you succeed. But yeah, use your HSNs. We all do that. And just helping you understand where the current pulls and pressures might be. And as I said, I've already mentioned like the structural setup. But yeah, there's lots of pulls. It's a fluid landscape. And the other thing I think we're really good at doing is just help you think about those big challenges. I had an excellent presentation from a company yesterday on sustainability. I won't name the names, but we're just trying to make sure that they don't forget about the other big topics like health inequalities, like social value, etc., etc. So, you know, we do want to make sure that your value proposition can take care of all of these big challenges, and it's important to do that. I'm a fan of this second to last bullet point, making things simple. If it's simple, it's likely to get done. You know, we can't underestimate that in the NHS. You know, the front line are you know, breaking point at times, and they've just undergone a lot of intense work in COVID. So we need things to be simple. We need it to be effective, and helping you tell the story. Tom said it as well, but you know, we want you to promote this. If you promote, if you get active, it will have that movement effect that we need. And help build the business case. I think there's one final slide just to say thank you and my contact details on some 4 great areas of this SBRI, and I'm really looking forward to seeing what might bring. I've got some own ideas myself as well, and as I said, I'm a big fan of digital. I think we absolutely need more digital to connect us together. I mean, I'm promoting right here, right now, some social media platforms because we need it to connect. You know, one of the biggest things that we can do is get together to create that movement, and digital helps us do that. And you only have to look at how powerful these social media companies are with their products, and perhaps we take a leaf out of their book. So thank you and good luck.
Thank you very much, Pete, for your insightful talk. And now, last speaker, but not least, is Rebecca, Rebecca Stevens, Program Manager from the SBRI PMO Program Management Office. who will talk about the application and the assessment process. The floor is yours.
Thanks, Katerina. So yes, hi, I'm Rebecca, and as Kat said, I'm a program manager in the SBRI PMO, and I'm going to talk you through the application and assessment. So first of all, right at the beginning, when developing the competition challenges, we consult the NHS long-term plan and other strategy documents alongside our work with stakeholders across the NHS and key opinion leaders to identify areas of unmet need and potential solutions that help us hone the challenge brief. And the resulting SBRI Phase 1 competitions are open to organisations based in the UK or EU from the private, public and third sectors, and applications are completed via our online portal. So after the submission deadline, applications are reviewed by a pool of clinical, technical and commercial experts and the SBRI Programme Management Office as well. And I'll go through the assessment criteria in a subsequent slide. So up to 25 applications are then shortlisted by the panel chairs, and the number of shortlisted applications each competition just depends on the quality of applications and the budget available for that round. So shortlisted applicants will then be invited to present a 3-minute video pitch to support their application, and that will also be reviewed by our expert panel. And the final funding decisions are made by the SBRI Healthcare Panel. So awarded projects will then undergo due diligence and contracting, and projects will commence shortly after this has been completed. So as Randa mentioned in her presentation, at the end of Phase 1, projects are expected to have established the technical merit, feasibility and commercial potential of the proposed technology. And only successful projects from Phase 1 should be thinking about applying for Phase 2 funding. So this is a competitive process, and Phase 2 funding isn't guaranteed to Phase 1 projects. So the Phase 2 application process is similar to Phase 1. So applicants will be invited to complete an online application form. This is then sent for peer review, and applicants will be invited to give a 15-minute presentation to the selection panel, followed by a Q&A session, which will be assessed by the panel. So Phase 2 projects can be for a maximum of £800,000 for up to 12 months. And Phase 2 contracts are intended to develop and evaluate prototypes or demonstration units from more promising technologies in Phase 1. Next slide, please. So as I mentioned in the previous slide, after the submission deadline, applications will be assessed by a panel of experts and the SBRI PMO, and they will use the following criteria. So first of all, what will be the effect of this proposal on the challenge outlined in the brief? So applicants will be scored on how well the proposal meets the market or patient needs as described in the competition challenge brief, and how it could be implemented to deliver benefits to patients and the wider system. And this is weighted at 20% of the overall score. So secondly, is the project plan, deliverables and risk mitigation strategy appropriate? So a detailed plan should be provided with a clear exit point, and the proposed timelines must be reasonable for the work packages laid out, and each work package should have appropriate milestones or endpoints for the end of Phase 1 to demonstrate the project's progress. Assessors will also be looking to see that key risks have been identified and that appropriate mitigation has been put forward. And this second criterion is weighted at 15% of the overall score. So thirdly, will the technology, device or solution have a competitive advantage over existing and alternative solutions? How innovative is the proposal, and are the arrangements surrounding the use and development of intellectual property appropriate? So applicants will be scored on how innovative the proposal is compared to existing solutions, whether the technology has a clear USP, and should have appropriately considered ownership of any background IP, evidence of freedom to operate, foreground IP ownership and future IP protection. And this criterion makes up 15% of the overall score. So the fourth criterion, does the proposed project have appropriate commercialization and implementation plans? So is there a clear plan for commercialization of the proposed innovation and a well-considered route to market? For example, assessors will be looking if additional funding is required for commercialization, is target pricing discussed, and is it clear how the applicants will engage with the NHS and other social care settings to ensure that the solution can be implemented. And this criterion makes up 20% of the overall score. So criterion 5, does the project include consideration towards patient and public involvement? And this is weighted at 5% of the overall score. So patient and public involvement and engagement, or PPIE, is a key requirement for SBRI funding. And applicants will be assessed on how well they will involve patients and public in the co-design and development of innovations, how well they ensure that the innovation will be acceptable to patients, and how they plan to engage with patients and public throughout the project. So next, does the proposed technology have potential to enhance equity of access and contribute to net zero emission? And this is weighted at 5% of the overall score. So as mentioned in many previous presentations from my colleagues, so in 2020, obviously the NHS became the first health system in the world to commit to reaching net zero, with a target to reach net zero by 2040 for emissions the NHS controls directly. And so applicants are expected to demonstrate alignment with this commitment. I mean, particularly as that is the target of this call, but that's an important criterion in all SBRI competitions. And the second component of this criterion mentions equality and diversity, so equity of access. And the SBRI healthcare programme is committed to promoting equality, diversity and inclusion, and reducing health inequalities through the development of technologies and solutions that it funds. So applicants are expected to analyse the impact of their technologies on the wider population and people with protected characteristics, underserved and underrepresented populations, and to also consider the geographical reach of their technology. So criterion 7, does the company and project team appear to have the right skills and experience to deliver the project? And that's weighted at 15% of the overall score. And in support of this, applicants should ensure that they include complete descriptions of team members, subcontractors, advisors, clinical and healthcare professional partners, as well as detailing their experience, what their role will be in the project, and their FTE commitment and associated costs. And finally, are the costs justified and appropriate? And that's weighted at 5% of the overall score. So proposed projects can request a maximum total of £100,000 net costs, and assessors are required to judge the application finances in terms of value for money, evaluating whether the proposed cost for effort and deliverables in a proposal reflect a fair market price. Next slide, please. So while the success rates do vary round to round for SBRI healthcare competitions, to give you an idea, across all rounds so far, the overall success rate of applicants to phase 1 is currently 9.4%, and 49% of phase 1 projects are subsequently awarded phase 2 funding. Next slide, please. So the application process is run through the SBRI webpage, and you'll find details of all open and closed competitions here and links to relevant documents. And if you navigate to competition 22, then you'll be taken to the competition homepage. So the homepage looks like this on the left. And here you'll, as I said, find all the supporting documents and key competition dates. So when the competition goes live on the 24th of August, there'll be a button at the top of this homepage to start an application, and that will link you to our online portal where you can complete and submit your application. So just briefly going through the key supporting documents. So you've got the invitation to tender, providing a brief summary of competition challenges, the application and assessment process and conditions. Then the applicant and portal guidance document, which provides detailed guidance on how to complete each section of the application form and provides information on how to use the research management system, which is our online portal, including registering for an account and practical steps to create, complete and submit your application. The challenge brief, as Randa mentioned, provides a detailed background to the competition and describes the specific competition challenges, as well as some other useful information for applicants. And I'd really recommend that you read that thoroughly before applying, as well as consulting the guidance document. And you can find a template application form for you to familiarize yourself with, and the frequently asked questions as well. And just to let you know, the competition webpage link will be circulated again in the follow-up email to this event. Next slide, please. So as I said, the applications for this competition are managed through our online portal research management system. And in order to apply, you'll need to first register for an account, as will all of your team members, any subcontractors and clinical partners as well. And we'd encourage you to do this as soon as you can, once you know that you want to submit an application, as it can take a couple of days for new accounts to be approved. Next slide, please. So once you've successfully registered your account, when you log in, you'll be taken to a page like this, and you'll first need to update your basic information, such as your name, institution, address, and update your CV by clicking on the left-hand menu, Manage My Details. And you can also find open funding calls via your account homepage if you click here as indicated. Next slide, please. So you'll then be directed to a screen showing you details of all open calls, and you should be able to select the round which is applicable, so in this case competition 22, to start an application. Next slide, please. So when you start an application, instructions will be provided in the introduction section. And as I mentioned before, there is also detailed guidance available on the competition web page. So in order for your application to be accepted, you must make sure that you've answered all mandatory fields in the application form, and these will be indicated with a red asterisk next to the questions. And if you don't complete these, you won't be able to submit your application. Just so you know, if you can't complete it all in one sitting, there is an option to save and close and return to the application at a later date. Other important things to remind you of, so all members of the project team and any project partners will need to be invited through the online portal to participate in your application, and after which they must confirm their participation. And the same process applies to any clinical partners and subcontractors, and the application can't be submitted without doing this. So as I mentioned before, you should ensure that all of your team members are registered on the portal, and once their account is registered and approved, you'll be able to invite them. So please, we just ask, do make sure you do this well ahead of the deadline and are on top of any of your co-applicants who haven't signed up for an account. Next slide, please. So when logged into the RMS, any co-applicants will be able to see applications that they've been invited to participate in via the My Co-applications tab. And they can click on the circled icon to view the application. Next slide, please. And so they'll then be taken through to a page asking them to confirm their participation on the application as shown here. So again, just to remind you, the lead applicant won't be able to submit the application until all co-applicants have confirmed participation. So again, just make sure that this has been done well ahead of the submission deadline. And once you've completed the form, co-applicants have confirmed their participation, you can validate to ensure that all sections have been completed correctly. And as I said, you'll need to have completed all mandatory fields. You'll need to provide a complete breakdown of your requested budget using the template spreadsheet provided, and give full descriptions of any team members, clinical partners, and subcontractors. And there is a risk that any incomplete applications may not be considered for review. But providing that you've completed everything correctly, you are then able to submit. I think that brings me to the end of my presentation.
Thank you, Rebecca, very much. And I'm conscious that we overrun with time. So as you see on the slide, what I was going to suggest is that we will make sure that we can answer all your questions offline after the meeting is completed. But also, drum roll, we are hosting another Q&A session on the 8th of September for you to come and fire away as many questions as you have, and either were unanswered today or that came up after you have looked at our guidance. Remember that the site will go live on the 24th of August. So I would invite you to look at our website. We'll publish an FAQ shortly after the end of the webinar to cover what we couldn't address today. And also we will have members of the program management team and the Greener NHS team there to answer further questions. So this is not your last opportunity to ask. We knew it was going to be a packed day. So apologies if we couldn't accommodate all of your requests to date, but we will make sure we can answer. And if you can go to the next slide, please, Alice. So I want to thank all the speakers that joined us today for their interesting insights and talks. And also tell you that if you want to reach out to us, you can use our inbox, or we are at the end also of a phone number. The inbox is checked regularly by us, so we will respond your queries then in a timely manner. So please do use and abuse our email address if you need. With this, I go to the next slide. There you go. So that drives us to the end of the day. I thank you all for your time, and we will make sure that we can address all your questions in a timely manner. Thank you very much for staying with us until the end. Bye all.